Beth, if a textured implant which were put in 8 years ago with no problem suddenly swell, what does this mean? Oh, Beth, funny you should say that, because that is my next one. Right, I'm going to go to it. Thank you, Beth, for asking me that question, because here we go. That's useful information. 8 years ago with no problem suddenly. Right, there you go, Beth. Swelling of your breast after implants. Okay. What this means, Beth, is that you need to seek help. Is if you have had implants and they suddenly swell, then you need to seek help. So there's a couple of things. The first thing, and the obvious thing, if someone phoned me up and said, oh my God, my implants just swelled up, the thing that I would worry about is infection, number one. But if the overlying skin looks normal, if it's not painful, it's not tender, then infection is sort of less likely. And so I would be less worried about infection. So infection would be my first thing. I'm like, oh my God, it's infected. And yes, you can get an infection. You know, obviously the risk of infection is the first few weeks after having surgery, but there is a possibility of getting infection years later. It's not common, but it's out there. And it's usually due to some kind of transient bacteremia, bacteria getting into your bloodstream somehow. Could be something like dental work, having some dental work and, you know, some bacteria get into your bloodstream, or if you have an illness, a cold, a flu, something like that, you can get some bacteria. So it's a rare, but it can happen that you can get infection sometime after surgery. So that'd be number one. But if the breasts look normal, as in terms of the skin looking not red, not inflamed, not tender, and it just looks swollen, then that's different. Then I'd be less worried about infection. Then that's a spontaneous swelling. And the main thing, the first thing I would think about is ALCL. So ALCL is a type of cancer associated with breast implants. It's very rare. So I wouldn't fly off the handle and I wouldn't go crazy about it because it's a very rare thing. But it's the first thing. Obviously, you want to, you know, exclude the important things first. So it seems to be related to textured implants, and it usually presents as a lump or a swelling sometime after surgery. 8 years, it's classic, to be honest. You know, that sort of time frame. And so that's the first thing I'd want to exclude. So my advice would be go and see a surgeon. Call up your surgeon, ring up your surgeon. Yes, we're all locked down all over the place, but we're still here. And we're still, I don't think I'm your surgeon. If I am your surgeon, call me, but I don't think I am. But if I, you know, call your surgeon and say, I'm a bit worried because I've had a swelling, and I'm sure they will, you know, treat it seriously and see you. Because ALCL would be the first thing that you would worry about, and then they'd have to go down the road of what do you do about it. And so the sort of way you go down the road would be, the first thing would be a scan, which would usually be an ultrasound scan, you know, like when you're pregnant, just to delineate the swelling and see whether what the swelling is, whether it's solid or fluid. It's probably fluid, and then at the time of the ultrasound they might be able to put a little needle in, drain some fluid off, and then they would have to specifically test for ALCL with that fluid. Now, if it is ALCL, it is treatable, and it's treatable by removing the capsule, the scar tissue that will have formed around the implant, and the tumor. The ALCL is a cancer. It's not breast cancer; it's a lymphoma. The vast majority of cases are cured by removing the capsule with the implant. And but the first thing would be to make a diagnosis. So that's the number one exhibit A thing that I'd be worried about. As I say, if the skin looks normal, then I'd not really worried about infection. If it's just a spontaneous swelling, then ALCL needs to be excluded first. Now, if ALCL is excluded, then you say, well, what is it? I'm like, okay, well, that's good. ALCL is excluded, thank goodness. Well, then it's probably a spontaneous seroma, a spontaneous swelling of your breast. Again, it's a very rare thing, but it's certainly not unheard of. When they do the ultrasound, as well as taking some fluid away for checking for ALCL, they could drain it. They could remove all that fluid. Sports bra on, hopefully it'll settle. If it doesn't and it keeps on coming back, then you can look at things like seeing if there's a reason for the swelling, if there's something there, foreign body or something, and you might need to have your implant removed, maybe your capsule removed. But the first stage is we check for ALCL, drain the swelling, supportive bra, hope it doesn't come back. Well, assuming it's not ALCL, hope it doesn't come back. And it might have been, again, it might have been some kind of transient infection that we didn't, or you were just a bit run down and you got a bit of localized swelling in the breast, not necessarily infection, but just swelling, which might, once it's drained, settle as quickly as it's come. And I have seen that. I have seen people, in fact, I've seen people where we haven't drained it and it's just settled on its own. So they can settle. So don't worry too much about it. But I think the main message to you would be that you have to go and get it checked, because the first thing is we need to remember that ALCL is out there, although it's extremely rare. So don't be too sort of, oh my God, he's told me I've got ALCL. It's just like, that's what we need to be thinking about. So yeah, good question, Beth, and that's where I would be on that one.